So, let's talk about fitness. For decades, getting in shape meant a few things. It meant a gym membership you might use. It meant a scale in your bathroom that you probably dreaded. It meant trying to guess if you were making progress. The whole process was based on feelings and guesswork. We lived in a world where the most sophisticated piece of fitness tech for the average person was a simple stopwatch or a clunky chest strap heart rate monitor. But then, something changed. Technology started getting smaller, it got more powerful, it got personal. The same revolution that put a supercomputer in your pocket started to creep onto our wrists, our fingers, and even into our clothes. This wasn't just about making things smaller, it was about bringing data into the equation. It was about moving from guessing to knowing. This new era is powered by wearable technology. These aren't just gadgets for tech enthusiasts anymore, they are mainstream tools for everyday people. All you need is a small device that lives with you, quietly collecting information that can empower you to make smarter, healthier choices every single day. At its core, wearable fitness technology comes in a few main forms. You've got your dedicated fitness trackers and your more feature-packed smartwatches. Think of fitness trackers as the specialists. They're designed to be lightweight, durable, and have incredible battery life, sometimes lasting weeks on a single charge. Then you have the smartwatches. These are the all-rounders, the jack-of-all-trades. A smartwatch does everything a fitness tracker does, but it also acts as an extension of your smartphone. Underneath the sleek glass and metal, these devices are packed with an array of sophisticated sensors. The most common is the accelerometer, a tiny sensor that detects motion. By analyzing the patterns of your movement in three-dimensional space, it can build a surprisingly accurate picture of your daily activity levels. Most modern wearables also feature an optical heart rate sensor. This is a technology called photoplethysmography, or PPG. The lights illuminate your capillaries and a sensor measures the amount of light that's reflected back. Let's break down the data these devices collect. The most basic and well-known metric is, of course, step counting. The classic goal of 10,000 steps a day has become a cultural phenomenon. It's a constant, gentle nudge to get up from your desk, to take the stairs, to park a little further away. It gamifies movement, turning a mundane day into an opportunity to hit your goal. Next up is heart rate monitoring, and this is where things get really interesting. Your wearable doesn't just tell you your heart rate during a workout, it tracks it all day long. A lower resting heart rate is generally a strong indicator of good cardiovascular fitness. As you get in better shape, you can literally watch that number trend downwards over weeks and months. Then there's sleep tracking, which might be one of the most underrated and impactful features. We spend a third of our lives sleeping, yet for most of history, it was a total black box. It breaks your night down into stages: light sleep, deep sleep, and REM sleep. Each stage is critical for different functions, from physical recovery to memory consolidation. Modern wearables track a growing list of other useful metrics. They can measure your blood oxygen saturation, use GPS to map your outdoor activities, and estimate your VO2 max. So you have all this data: steps, heart rate, sleep stages, HRV, blood oxygen. That's great. But a list of numbers isn't very helpful on its own. This is where artificial intelligence, or AI, comes in. The AI acts as your personal data scientist, working 24/7 to find patterns, identify trends, and deliver actionable insights that are tailored specifically to you and your body. Instead of giving you a generic goal like 10,000 steps, the AI learns your habits. It sees that you're consistently hitting 6,000 steps, so it might suggest pushing for 6,500 this week. Some platforms use this data to generate readiness or body battery scores. These are simple, single-number scores that distill complex data into one easy-to-understand metric. AI is also getting incredibly good at activity recognition. Now, you can just go. The AI can automatically detect that you've started exercising and differentiate between walking, running, swimming, and cycling. It's the AI that can correlate your late-night coffees with poor sleep quality scores and highlight how your activity levels change between weekdays and weekends. The true test of any technology isn't about its specs, but the impact on real people's lives. For example, a busy office worker who started taking short walks thanks to hourly stand reminders eventually lost 40 pounds. It wasn't about some drastic overhaul, it was all about those small, consistent changes prompted by data. Amateur runners used heart rate zone data to train smarter, not just harder. This data-driven approach helped one runner shave minutes off her half-marathon time, breaking a personal record she had been chasing for years. A college student overwhelmed by exams noticed his resting heart rate creeping up. His watch recommended guided breathing exercises, giving him immediate feedback that his coping strategies were actually working. These stories share a common thread: empowerment. The technology provided clear, objective, and personalized information that had been previously invisible, creating awareness that motivated action. The world of wearable technology moves incredibly fast. One of the biggest trends is the move towards less invasive form factors. We're already seeing this with smart rings that pack many of the same sensors into a small, discrete ring. We're also seeing the rise of smart clothing. Think of shirts with ECG sensors woven directly into the fabric, or shorts that can analyze your running form in real time to help prevent injuries. For years, the holy grail has been blood glucose tracking. Imagine monitoring your blood sugar levels in real time without a finger prick. This would be a monumental breakthrough for metabolic health optimization. The software and AI are getting exponentially smarter. The future is about providing sophisticated and predictive insights. A wearable that can predict you're at higher risk of getting sick and should focus on rest and nutrition. While these devices are marketed for fitness, their most profound impact might be in serious health monitoring. The ECG feature can detect signs of atrial fibrillation, alerting people to seek medical attention for conditions they never knew that they had. Fall detection uses accelerometers and gyroscopes to detect hard falls. If unresponsive for a minute, the watch automatically calls emergency services and sends location to emergency contacts. Continuous heart rate monitoring looks for abnormally high or low rates at rest. While not a medical diagnosis, these alerts are a powerful prompt to consult a doctor, turning passive symptoms into active, data-backed reasons for medical advice. This transforms the device from a nice-to-have fitness gadget into an essential tool for personal safety and preventative health. It's a guardian on your wrist, quietly watching over you 24/7. All of this technology is meaningless unless you decide to use it. The most important step in this entire revolution is your own. It's about making the decision to take a more active role in your own well-being. Start small. Maybe your first goal is just wearing the device for a week to get a baseline. From there, set small, achievable goals, hitting your stand goal, adding 500 steps, or going to bed 15 minutes earlier. Use the social features to your advantage. Share your activity with friends. Start friendly competitions. Accountability is a powerful motivator, and celebrating small wins together makes the journey more enjoyable. Ultimately, this is about investing in your future self. Every healthy choice you make today is a deposit into your long-term health bank. Your future self will thank you for it. Looking ahead, the future is brighter and more integrated than we can imagine. We can envision wearables in constant, secure communication with your doctor's office, giving physicians a much richer view of your health than a 15-minute annual appointment. The form factors will disappear into the background. We might see smart patches that stick to your skin for a week, or hearables that measure core body temperature and blood pressure from within the ear canal. The AI will become a true digital twin, creating a complex model of your personal physiology. It could run simulations, predicting how your body might react to a new diet, workout plan, or medication. The ultimate vision is a world where technology helps us live longer, healthier, more vibrant lives, where chronic diseases are caught earlier, fitness is personalized and accessible, and we're empowered with deep understanding of our bodies. The devices we see on wrist today are just the first chapter in this incredible story. They are pioneers of a new relationship between humans and technology, connecting us more deeply to ourselves. The future isn't just coming, we're wearing it right now.